So this morning I read an opinion piece that I found on the CBC website. For those of you who aren't in Canada, the CBC is basically a state broadcaster that's funded by the federal government through taxpayers. And this one caught my eye, basically based on the headline, and it reads, "Pandemics are different. Why this isn't the time to assert your individual health rights." And this is written by a doctor in Saskatchewan, Dr. Cory Neudorf. I want to read a little bit of it and respond to it, as I think what Dr. Neudorf articulates in this piece is something that comes up a lot just in day-to-day life, as I think a lot of people share his opinion. I think there's some significant shortcomings with his opinion, frankly, but I thought I would read part of it for you today. It reads, "The COVID-19 pandemic is a global... let me start this again. The COVID-19 pandemic is a global threat to society that governments and public health experts in various countries have fought in various ways, but all have required citizens to think beyond themselves to fight a common enemy." So right away, he's setting things up that if the enemy is scary enough that we should be willing to forfeit some civil liberties in order to conquer that enemy. And right off the bat, he says that the COVID-19 pandemic is a global threat to society. I question that. Is it a threat to society? It's a threat to individuals. It's a threat to public health, certainly. It's a threat. It's not nothing. But is it really threatening our society per se? I mean, that's maybe debatable, but perhaps it's just a little bit of hyperbole to make his point. He says this has been complicated by social media propagating false dichotomies, extremist views, and distrust. In some cases, this has been encouraged by politicians politicizing a health crisis. This is something I hear a lot, that opposing vaccine mandates or having concerns about the vaccines themselves is politicizing a public health issue. And right away, I think we're missing what politics means. The fact that it's a public health crisis, emergency, pandemic, whatever you want to call it, the fact that it's public makes it political by its very nature. Politics is about discussing and debating the various policies that governments should take just to manage society. So to say that one side's politicizing it while the other's not doesn't make sense, because it is, how we respond to something like this, something that's public, is by very definition a political issue. He goes on, "The end result has been a polarization of the population and the creation of unlikely allies in the name of a perceived encroachment on personal rights and freedoms." It's interesting that he says it's a perceived encroachment as opposed to a real encroachment, which is interesting because in the whole piece he seems to argue that civil liberties are a real thing and generally should be protected, but if the threat's big enough we should get rid of them. But here he's saying that they're merely a perceived encroachment. I happen to disagree. I think it's a real encroachment, and we can debate whether the encroachment is warranted based on the threat. And he also points out that this is causing polarization, which is interesting, and he alludes to this being done by other people, by the people who are propagating false dichotomies, extremist views, etc. And then he says this creates the perfect conditions for continued spread of COVID-19. So the result is the pandemic will continue to spread if we don't do something about it, so he argues. He goes on to say, "We don't live in isolation," which is true. "In a pandemic, individual actions don't only result in individual health risks, but affect the entire population's health through increasing transmission." Okay, I'll take that at face value for our purposes here, although I might quibble on part of it. "Infectious disease outbreaks can only be managed through a collective public health response, requiring less emphasis on the right to make individual health choices." Well, here I disagree with the good doctor. He's saying this is the only way we can manage them. I think I'm not saying it's the best way to manage it, but certainly one way to manage it is to do nothing. That's would come with some costs, I'm sure, but that's theoretically one way to manage it. One could manage it potentially by treatment, one could manage it through voluntary vaccinations, but to say that necessarily it requires less emphasis on the right of the individual, I think is wrong. He says most people understand that there are times when individual needs and rights take a backseat to the broader needs of society, and that a balance between individualism and community responsibility is what creates a stable society. Now again, maybe I'm picking nits here. I think it's part of what makes a society stable, but I don't know if it solely is what's responsible for a stable society. I think there's lots of factors that go into a stable society. But I do tend to agree with him that to live in a society, we can't have absolute individual freedom, and that there is a balance to be struck. The question is, how do we find that right balance, and who gets to decide where that balance ought to be? And he says the COVID-19 pandemic started out that way, but a shift in thinking seems to have taken hold, where the recommendations of public health authorities, acted upon by governments, have been interpreted by a sizable minority as an unreasonable infringement on individual rights, out of proportion to the need for collective responsibility. I agree with him on that. I think I am in that sizable minority that thinks that this is what we're going through here in Ontario and Canada and many parts in the world for that matter, are an unreasonable infringement, that the response is beyond the threat. So we can disagree on that, but I think him saying that there's a sizable minority, I think is indeed true. And then the very next paragraph, and this is something that irked me. So he talks about there being a sizable minority, and then the very next thing he says is conspiracy theories, lies, and pseudo-scientific misinformation campaigns are aimed at increasing distrust in science or governments. Now, to be very charitable, maybe this is just sloppy writing. It's a separate paragraph, but to me he seems clearly trying to tie the sizable minority who think that the curtailment of rights are unreasonable, of which I count myself part of that they're part of these conspiracy theories, that they're liars, that they're pseudoscientific, that they're spreading misinformation campaigns and trying to increase distrust in science or government. And then he goes on, by falsely, and this is interesting, by falsely reframing the need for a collective pandemic response into an individual rights issue, we create the perfect conditions for the pandemic to drag on and prolong the need for restrictions and mandates. So I'm not sure why he says it's a false reframing. Maybe he means like invalid in his mind, but how we frame something true or false exactly? So I'm not sure if that, again, is just sloppy writing, or if he somehow feels that framing it as an individual rights issue is somehow not acceptable. I assume it's that. And then again, he says that by doing that, the pandemic will drag on. He writes, it is recognized that access to common infrastructure, goods, and services such as roads, public education, health and social services creates a more stable society and should be financed collectively. And I think what he's trying to say here, and it's a reach, first of all, he says it is recognized. He doesn't say exactly by whom. But I think he's saying we all generally recognize that there are these public goods that we pay into. And then he goes on, I think, to allude that because we do that, because we act in the collective when it comes to roads and bridges, we should also act in the collective when it comes to our response to a pandemic. And he says, we all have to abide by rules to ensure our society functions safely and somewhat predictably. Traffic laws, property laws, and criminal laws ensure our individual rights are maintained by imposing restrictions on what others can do that negatively impact us. I think he's generally right about that part. We do, as a society, generally agree on what things should be common goods, like roads and bridges. What he doesn't, he oversimplifies things here. What he doesn't seem to recognize is how we provide these collective goods and services is something that we debate in a Western democracy daily, in the news media, in parliaments, in Congress, at the local level, at provincial or state levels. These are things that we're constantly debating. There's constant discussion on what things should be in the common good, and people have different ideas of that. And people get to share their opinions, and governments ebb and flow based on the will of the people is the idea. But he seems to be arguing because we agree that a road is a common good, therefore the common good response to a pandemic, we should just take that as a given. He uses a lot of language talking about a common enemy. He says, when faced with a common enemy, and I find that framing a little bit worrying, because I think he's personifying the virus as an enemy, and maybe that's not so bad. But he goes on to associate people who maybe hold individual rights in higher esteem than the response to the pandemic, that they tend to get lumped in with the enemy. And he says as much. And he says, but if enough people decide not to take part, that is in the mandates or getting their vaccines, etc., if enough people decide not to take part or to actively assist the enemy through misinformation and defying orders. So if you defy the orders of the health authority, or if you have a dissenting opinion, I guess in his opinion that's misinformation, that we are assisting the enemy. And that's a pretty strong allegation to make. It's a very small step to say who's assisting the enemy versus who is the enemy. And then he goes on to say, we lose the battle and prolong the war with many more casualties. He says this pandemic has seen an incredibly fast scientific response to the virus. In an unprecedented time, we have discovered the cause. I don't know that we have discovered the cause exactly. I haven't maybe followed that, but from what I understand, that's not clear exactly. There's a lab leak hypothesis, but I don't know if we really know the cause. I think there's a lot more to learn there. We have discovered the cause, ways to prevent exposure, provide supportive therapy, and developed effective and safe vaccines. And then he says, rather than waiting for decades for the virus to burn itself out, taking a large portion of the population with it, we can stop it in a fraction of the time with far fewer casualties. Well, I think that's conjecture. I don't know that we know enough about this pandemic to know for sure that by not doing these things that a large portion of the population will go with it. I guess it depends how you count large. And he says we can stop it with fewer casualties. I don't know that we know enough. There's lots of jurisdictions where there's high vaccine rates, yet there's still spread. So I think it's unreasonable to be so sure of the outcomes of these policies. He says this is only possible if we continue to act collectively and take advantage of these tools. Refusing vaccines and protesting short-term mask mandates and other restrictions. I don't know if 20 months counts as short-term. I would say that's a longer, medium to longer term. But by refusing these vaccines, the whole society is at an increased risk. And this is interesting because, and again, I talked about this in other videos, but it seems like we're arguing, or he's arguing, that the vaccines are both effective, and by one not getting this effective vaccine, somehow one increases other people from getting sick. So the degree to which the vaccines are effective is the same degree to which someone who's vaccinated doesn't have to worry about someone who's unvaccinated. Or put differently, the degree to which the vaccines are ineffective is the degree to which a government is mandating an ineffective vaccine. But you can't really have it both ways in my mind. Either it's mostly effective or mostly ineffective. But this writer here, and I think others like him, seem to want to be on different sides of that argument, or put it differently depending on which argument they're making. Then he writes, for many health issues, we can rightly assert our own right to assess the risks and benefits. So he's saying under normal circumstances, yes, our health choices should be our own, but he says that pandemics are different. They can only be managed successfully by collective actions at the level of the community, and require us to put the health needs of society at a higher level. Higher level than human rights, it seems, he's arguing. I guess my question for him is, how does he assess the cost of the curtailment of these human rights? Are they zero? If they're non-zero, what are they exactly? And how does he balance those against the costs of the pandemic itself. He says relatively small limits on our individual choice has always been a price. I don't know if these are relatively small limits in the grand scheme of things. We're talking about, early on, effectively many jurisdictions being under house arrest. And I'm not necessarily saying that was absolutely unwarranted in the early days, but that's a significant. I wouldn't call that a relatively small infringement on our human rights. Access to employment. There's lots of people who have lost their jobs because of this. Is that a relatively small limit of their individual rights? Restrictions on travel in and out of one's country, or sometimes from province to province. I'm not sure about state to state in the United States, but certainly in Canada, some provinces have restricted travel from out of province people. So I don't think these are relatively small limits. These are large, sweeping limits to our rights. And then lastly, he says that a community's success depends on people coming together, thinking beyond the individual for a broader purpose. It's always been that way. I don't know if it's always been that way exactly. I'd have to think a little bit more about that. But he's basically saying that because the pandemic's big enough, we should be quick to give up our rights. And I guess my question again to Dr. Neudorf is there anything bad that could happen if we give up our rights? Has that ever happened where we've had a large number of people whose rights were curtailed? Did that ever bring any sort of ill or cost to society throughout history? And if so, what are those costs? And are we willing to pay those costs in order to attempt to curtail this pandemic? Which, as the evidence is showing, not to say that the vaccines are doing absolutely nothing, but we still seem to be getting spread of new cases with vaccinated and unvaccinated people. So this solution that he seems is so clear, and that we should be very quick to be willing to pay that cost, I disagree. I don't know that the pandemic is severe enough to pay these significant costs in terms of our own individual rights.